Hello, everyone. Okay, so I'm back with a new series, just two videos about what I call overlooked issues. And the first thing I'm going to talk about is erection issues, a little bit longer video than a shorter video on premature ejaculation and what these issues are and how to overcome them. So they're not talked about. So the first is the need for the penis. For you guys, your penis needs continuous stimulation in order to get and maintain, okay, an erection before and during sexual activity, particularly during sexual activity. Okay, so it's when you look at pornography, it doesn't show that. It doesn't show the male actor before he has an erection, or even getting one. So for people who don't know any better, often it's assumed that as soon as my clothes are off, I've got to have and keep an erection in front of a woman. Guys, no, it's not physiologically possible. All right. Maybe when you were 12 or 13, but now you're not going, you're biologically, your penis needs blood flow. So it needs continuous stimulation to maintain the level of the erection that is desirable for you. Okay. And it's natural during a sexual encounter for it to wax and wane. That's just, it's like a storm system. It comes in and it goes out. I mean, that's just how it is. So you're making out, you're getting aroused, you're getting erect, and then maybe the phone rings, or you move to the bed, or you have to go to the bathroom, or you get a cramp. Lots of interruptions happen during the flow. You know that. So you got to deal with it. And so what you do is you can self-stimulate, you can have your partner stimulate you, oral sex. There's lots of things you can do to kind of get back into the groove and not worry about it. But what happens is if you're already worrying about it because that's your tendency, it'll become a self-fulfilling prophecy and you won't be able to get your erection back because you'll be too worried about it. So that's one thing that's overlooked, and that's how you overcome it. Okay, you got to deal with it directly. The other thing is kind of sounds like the opposite, but there are those of you out there who have trained yourself from usually from adolescence to masturbate by rubbing, okay, against the floor, against the carpet, whatever, okay, where it's hard surface. So that amount of your whole body weight's on your penis, and your penis gets used to that, so that if you do graduate to masturbating with your hand, it's likely going to get real aggressive in order to get the amount of pressure you need to stay stimulated. So your body gets acclimated to that. Then fast forward, you get older and you want to now, be with a partner. It gets pretty difficult to be with that partner when you can't, um, it's just not enough. The hand, the mouth, vagina cannot compete with that amount of pressure. So you have to learn how to retrain your body. And I work with people on this directly, but retrain your body to be able to accept a less amount of pressure in order to maintain and then ejaculate. So if some of it has to do with your own practice, there is a tool. I'm not trying to sell it, but there is a tool that can be helpful. It's called a Fleshlight. I think there are other versions or brands. Basically, it's a sleeve that's plastic you put over your penis, and you're able to, so some of them you can modulate the amount of pressure you're getting, squeezing it tighter or whatever. But basically, it's simulating a vagina for you, right? So that you can practice with some lubrication and with masturbation, so that you again your body can acclimate to that. So that's just a couple right there. And I'll just check my notes about this if there was anything else. I think that's most of it. Yeah, the fleshlight is important, and I spoke about these 2 points, right? Yeah. So I'm going to come back with another quick video about overlooked issue that has to do with PE and how to premature ejaculation. Okay, thank you.